Hello, I'm Dr. Robert Schultze. Today, LASIK is the most popular form of refractive surgery for reducing dependence on glasses or contacts. In this video, you'll see several real-life patients talking about their positive experiences with LASIK. The people who are happiest with LASIK are the ones who take the time to understand their own visual needs and what LASIK can and cannot do for them. The purpose of this video is to help you develop informed and realistic expectations. If LASIK is appropriate for you, you could join the many people who have benefited from this widely performed procedure. If you have questions after watching this video, I will be happy to discuss them with you.
My name is Brent Deal, and I am a director and a cameraman of television commercials. And I've been wearing contacts since 5th grade.
I'm Jerry Betromovitz. I am a certified financial planner, practitioner, and money manager. I've sailed the majority of my life, and one of the problems in sailing has been I'm often in the wind, and sometimes the wind would come underneath the contact lens, dislodge it or irritate or create dry eyes.
Well, my name is Mary Stevens. I'm a scientist by profession. In my other life, I spend as much time as I can in the outdoors, hiking and biking and camping and a lot of backpacking. I started wearing hard contact lenses when I was 14, and with hard lenses, they're, in my opinion, are really never very comfortable. And I switched to soft, extended wear lenses.
We worked some pretty long days. Towards the end of the day, my eyes would get pretty tired, and I wouldn't trust them as much as in the morning. They just would change over the day, and they would hurt. So I would actually have my assistant focus the camera for me, just to make sure that it was right.
Several years ago, I became aware of the LASIK procedure and started hearing more and more about it and about the success of some of my friends and colleagues that went through the procedure.
I was interested in this procedure, and I looked into it and thought it was right for me.
If you are considering LASIK, you're joining millions of people who have decided that they would like to reduce their dependence on glasses or contact lenses. You and your ophthalmologist will work together as a team so that you clearly understand how LASIK works and what you should expect from your surgery. In this video, we will see how LASIK has made a difference to so many people. But first, let's take a look at how the eye works.
Light rays enter the eye through the clear cornea, then through the pupil and the lens. These light rays are focused onto the retina, a light-sensitive tissue lining the back of the eye. Signals from the retina are sent through the optic nerve to the brain, where they are interpreted as the images we see. 70% of the eye's focusing power comes from the cornea. When people have problems seeing clearly, it is frequently because of a refractive error. LASIK is specifically used to treat myopia, nearsightedness, hyperopia, farsightedness, astigmatism. Myopia is also known as nearsightedness. This occurs when the distance between the cornea and the retina is too long. Light rays entering the eye are focused in front of the retina, causing the image that falls on the retina to be blurred. Hyperopia is also known as farsightedness and occurs when the distance between the cornea and retina is too short. Light rays entering the eye have not yet come into focus when they reach the retina, so again, the image is blurred. Astigmatism is a condition in which the cornea is curved unevenly. A cornea that is curved the same in each direction is shaped like a basketball, while a cornea with astigmatism is more curved in one direction than the other, like a football. Light passing through this uneven cornea is not properly focused on the retina. People considering LASIK might have one or a combination of these conditions. For many years, glasses and contact lenses were the only way to correct these refractive errors. But today, LASIK is offering people an alternative that can reduce or eliminate their dependence on corrective lenses.
LASIK, or laser-assisted in situ keratomileusis, is an outpatient refractive procedure. It combines surgical and laser treatment to reshape your cornea. LASIK is used to treat certain types of nearsightedness, farsightedness, and astigmatism. It is the most common type of refractive surgery, accounting for more than 90% of all refractive procedures performed today. With LASIK, there is generally little discomfort during and after surgery, and you recover your vision quickly.
With LASIK, your ophthalmologist creates a small flap in the front portion of your cornea using a laser. Tiny, quick pulses of laser light are applied to your cornea with a special laser device. Your doctor creates a flap in the cornea by gently separating the tissue. The corneal flap is then folded back. Once the flap is lifted to one side, laser energy is applied for a few seconds to a minute or so to reshape the cornea. Then the corneal flap is returned to its original position where it adheres naturally. After the procedure, the reshaped cornea focuses light more accurately on the retina.
Millions of people today have had refractive errors such as nearsightedness, farsightedness, and astigmatism corrected with LASIK. Now there is a version of LASIK available called Wavefront Guided Custom Laser Surgery, or Wavefront Guided LASIK. One of the main differences between conventional LASIK and Wavefront Guided LASIK is that with conventional LASIK, the laser tends to use the same power treatment over the center and periphery of the cornea, whereas with the wavefront treatment, the treatment over the peripheral cornea is modified to further improve optical quality. For patients with larger pupils, particularly under low light conditions such as dusk or nighttime, quality of vision is generally improved. One of the keys to a successful LASIK procedure is the set of measurements your ophthalmologist takes to determine your refractive error. With wavefront guided LASIK, a special device is used to precisely measure the irregularities and variations in your eye. To understand how wavefront works, it's important to understand how your eye focuses light. A perfect cornea allows light entering the eye to be focused evenly through the pupil and then fine-tuned by the eye's natural lens, so that light rays fall precisely onto the retina. Small imperfections in the eye cause some light to travel through the eye at different angles. It is these imperfections that can cause the light to strike the retina in different places. Now, as a result, you may experience symptoms like halos, glare, starbursts, or ghosting of images. Interestingly, wavefront was adapted from technology used to fix the distorted images from the Hubble Space Telescope. Based on the same principle, here's how wavefront is used to help map imperfections in the human eye. A targeted beam of light is sent through your eye and focused on the retina. As the wave of light rays are reflected back from the retina through the eye's vitreous, lens, pupil, and cornea, a sensor measures the irregularities in the wavefront pattern of light as it emerges from your eye. Using this measurement, the wavefront computer is able to create an accurate three-dimensional map of your eye's visual system, including specific imperfections in the cornea. This wavefront data is used to program the excimer laser, allowing your ophthalmologist to customize the reshaping of your cornea. Wavefront guided LASIK not only corrects the eye's nearsightedness, farsightedness, or astigmatism, much as glasses or contacts do, but it corrects higher order aberrations that cause glare, poor night vision, halos, and blurry images. Higher order aberrations are distortions in your vision that cannot be corrected with glasses and contacts and can only be measured with wavefront analysis. It's important to understand that wavefront guided LASIK may not be suitable for everyone. Your ophthalmologist can determine if wavefront guided LASIK is an option for you. If you are a candidate for this advanced procedure, you'll join a growing number of people who are enjoying a better quality of corrected vision.
My wife dropped me off, and I went in, and they put the numbing drops in your eye, and then they march you into the big room.
I was told that it would be a fairly short procedure. I was in an inclined, relaxed position.
From what I understand, he puts something in your eye that keeps it open, and then he tells you to stare at this red light.
They had me look into a red light and to concentrate and focus on that. And then literally in under a minute's time, the procedure from the laser machine was completed.
I believe the LASIK procedure for me was 29 seconds.
And everybody had told me it was a very quick procedure. And quite honestly, you don't believe that until you look at this red light for 15 seconds, and he backs off and says he's done.
It was painless, completely painless, and came back out. They waited to make sure everything was settled back in place as it's supposed to be, checked me again in about an hour, put an eye shield on, and sent me home.
To be considered a good candidate for LASIK, you must have a stable eyeglass or contact lens prescription within a correctable range. You must be free of significant eye disease, and you should also understand the potential risks and side effects of LASIK. Side effects of LASIK can include dry eye, undercorrection or overcorrection, which may require retreatment, or poor night vision. Less common side effects may include inflammation, infection, or irregular astigmatism. Talk with your doctor about these and other more serious complications that may arise from having LASIK. While complications generally are rare, it's important to discuss them fully with your ophthalmologist. It's also important to discuss your expectations for vision after surgery. If you are considering LASIK, you're joining millions of people who have decided that they would like to reduce their dependence on glasses or contact lenses. You and your ophthalmologist will work together as a team so that you clearly understand how LASIK works and what you should expect from your surgery. When you talk with your doctor about LASIK, you should take as much time as you wish to make your decision before signing the informed consent forms. Just remember, as with any surgical procedure, you should have your questions answered before agreeing to have the surgery. If you decide not to have LASIK, there are other methods of correcting your vision. These alternatives include eyeglasses, contact lenses, and other refractive surgical procedures. Remember, LASIK is an elective procedure. There is no emergency condition or other reason that requires or demands that you have it performed. You could continue wearing contact lenses or glasses and have adequate visual acuity. LASIK is a common procedure performed successfully on millions of people each year. But as with any surgery, there are risks associated with LASIK. Let's talk about some of these risks. After LASIK, you may experience glare, increased sensitivity to light, or fluctuations in sharpness of vision. These conditions may or may not be related to the size of your pupil. They usually occur during a normal stabilization period of 1 to 3 months, but they may also be permanent. You could also notice a starbursting or halo effect around lights. This condition usually diminishes with time, but could be permanent. Also, your vision may not seem as sharp at night as during the day, and you may need to wear glasses at night. There is an increased risk of having dry eye following the LASIK procedure. This may be temporary or, on rare occasions, permanent, and you may need to use artificial tears, or you might need to have the tear duct openings in the eyelid closed. Overcorrection or undercorrection could occur with the LASIK procedure, causing farsightedness, nearsightedness, or astigmatism. If you currently need reading glasses, you may need them after having LASIK. You should understand that the visual correction that you can expect to gain from LASIK may not be perfect. For instance, there is the possibility that you might not get a full correction from the LASIK procedure, which may require future retreatment procedures, such as more laser treatment or the use of glasses or contact lenses. Also, the effect you gain from LASIK could regress, and your vision may go back to a level that may require you to wear glasses or contact lenses to see clearly. After having LASIK, your treated eye may be more vulnerable to injury from an impact, which could cause the flap to dislodge. You should wear protective eyewear when playing sports or whenever there is the possibility of having something hit your eye. Depending on the type of complication with the flap or the incision, risks could range from partial vision problems to loss of best corrected vision. After LASIK, mild or severe infection could occur. Mild infection can usually be treated with antibiotics. Rarely, severe infection, even if successfully treated with antibiotics, could lead to permanent scarring and loss of vision that may require corrective laser surgery or even a corneal transplant. You and your doctor should discuss your expectations for vision after LASIK. Be prepared to discuss what role vision plays in all areas of your life. Remember, LASIK is an elected procedure. Depending on your vision needs and desires, it may be better to continue using glasses or contacts. You and your doctor can discuss this further. While the outcome in the overwhelming majority of LASIK procedures is excellent, it's important to remember that the results of any type of surgery cannot be guaranteed. Although it's impossible for your doctor to inform you of every potential complication that may occur with LASIK, he or she will aim to answer all your questions to your satisfaction.
I did not have any problems with side effects such as dryness, so I will say I was told to use some eye drop, fairly frequently. It was part of my post-op instructions, and perhaps that prevented any dryness.
I didn't have any glare or hazing at night while driving. I didn't experience dry eyes.
The only side effect I can see there are halos at night when I drive. If it's a dark environment and there are quite a few cars on the road, I see quite a bit of haloing. They got a little bit better and have now seemed to have leveled off, but I'm still 2 months into this. But if this is the biggest minus I have to deal with all of the pluses I get from this procedure, then that doesn't bother me.
Back to one.
Laser vision correction may greatly reduce your dependence on glasses or contact lenses, but you may not be able to discard your corrective lenses completely, particularly as you get older.
I elected to have some reading glasses made for me so that I would be more comfortable reading for longer periods of time.
But if you and your doctor decide LASIK is right for you, you may join millions of people who have had LASIK and are enjoying active lifestyles that are less dependent on glasses or contacts.
In terms of having the LASIK procedure, all I can say is that I highly recommend it. Everyone, in fact, I know that has had it done has raved about the procedure.
A couple of things I noticed right away were that colors were more vivid. I was almost overwhelmed by peripheral vision, noticing things out of the corner of my eye which I couldn't have seen out of my glasses or contact lenses. And so I had so much more information to deal with, which was very exciting.
The majority of people get to take seeing for granted. The majority of us don't have bad eyes. I did have bad eyes, and I don't take seeing for granted. All my life I'd wanted good sight, and I didn't have it, and I do now. And it changes you on so many levels.